bent wherever is comfortable for you. So bend your bottom knee and the top leg goes straight. And then you want to measure 5 centimeters proximal to the joint line.
Okay.
So wherever her knee joint line is.
You know what? There'll be a mark on their knee joint line because I will put a mark on there when I do the clinical knee exam. So you'll just have to measure up from the line.
Perfect. So
How does that sound?
say the line is wherever and just measure 5 centimeters from there.
Okay.
And then wherever that mark is, that's where you're going to place the pad, the dynamometer pad, when you're doing the testing.
The bottom of it, like the bottom of the pad. Oh, the middle
The
of the
middle.
middle of the pad.
It just
Yep.
says it goes right over top of
Cool.
the mark. So. Okay. So in that protocol that was written up, it talks about using a stabilizing strap up here.
Yeah, no worries.
I don't use it,
'Kay.
but if you want to.
Okay. We'll fill.
Now, this is just like a level, inclinometer, like a level. Basically what you're gonna do is lift your leg up to the strap and just hold. And you're gonna position it where it says 0 degrees. So we have to adjust the strap to make her leg go a little bit lower,
Okay.
basically.
Cool.
You can just relax a little bit. And lift again. I don't know. As close to 0 as you
Yeah.
can get, right?
Yeah, how close is okay?
Well, we will talk about that.
Yeah.
Don't worry about it right now.
Yeah.
We'll try to get it as close as we can. But I think you'll find, again, that's one of those things, consistency will come way fast after you, as you practice.
Yeah, for sure. And then when you're using these straps, you make sure that you flip them through like that.
Okay.
They're more stable that way. Okay. So for this one, I'm going to turn the pad. I have one right here. Make sure that they stay right on top of their hip, so they're not falling backwards or forwards. And then you're just going to position this directly over that mark.
Okay.
Just relax your leg.
You're good, don't worry.
So wherever that mark was on the joint line, keep your knees straight, and then you're going to push up, and then you'll push as hard as you can, and then bring your leg down. So I didn't have it turned on. I'm going to do it again.
That was the test.
But that's the idea of what
Okay.
you're going to be doing. The tricky thing too is going to be your hand positioning. So try to make sure that you don't ever have your finger over top of the reset button.
Right.
Because you'll be pushing, 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 and it will never beep. That's why. Okay. Okay, so you're going to push up hard as you can. Push, 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 and relax. And then you take your value.
Write it
and
down.
then Write it down, and then wait 15 seconds and do it again.
Okay.
So the first one you can give them a practice run where you don't have to record the value, just to give them an idea of how it works. And then you want to do 3 more trials where you're recording the value and
Okay.
having about 15-second rest in between.
And can I correct them after the first practice run?
Yeah,
If they're-
for sure. Yeah. So I find it easier if you position them into the correct test position. So I kind of had my hand here and I was moving her leg back to where I want it to be. And just, you can even have, you can stabilize here, or you can use the strap, whatever you think will be better.